We know our healthcare system is challenging for and challenged by older adults with chronic conditions and complex health needs. This is especially true in primary care settings. At Johns Hopkins, we've been doing research around an intervention called guided care to help meet this challenge. In guided care, a specially trained nurse works as part of a care team. They help primary care physicians provide coordinated, patient-centered, and cost-effective health care to chronically ill patients. Data from a 3-year, randomized controlled trial showed that guided care improves the quality of patient care. It also improves caregiver perceptions of quality, physician satisfaction with chronic care, and it produces high job satisfaction among nurses. Now, here's more about the Guided Care Chronic Care Management Toolkit.
The Guided Care Chronic Care Management Solution is a 3-year license that allows you to use the guided care name, apply the very specific guided care protocol in your practice, and use the 4 essential forms that will guide the implementation of guided care into your practice. The health history form is the tool used to assess the patient. Part 1 is completed from a focused brief review of the patient's medical record. The rest is completed during a comprehensive in-home assessment interview of the patient and an evaluation of the safety and functionality of the patient's home environment. Your practice's health information technology merges the individual assessment data with pre-programmed, evidence-based, best practice management recommendations to create a preliminary care guide. This care guide lists medical and behavioral plans for managing and monitoring the patient's chronic conditions. The guided care nurse and the primary care physician discuss and modify this guide to align it with unique circumstances of the individual patient. The guided care nurse then discusses it with the patient and caregiver and modifies it further for consistency with their preferences, their priorities, and intentions. The final care guide summarizes the patient's conditions, medications, allergies, diet, physical activity, monitoring reports, care providers, family members, and other important data in a succinct, professional format. It's provided to physicians and other health professionals during scheduled appointments and upon admission to emergency departments, hospitals, home care, rehabilitation, and other venues of care. From this care guide, the guided care nurse generates a personalized action plan. The action plan is written in lay language and displayed prominently in the home to remind the patient to take medicines on time, eat proper foods, engage in healthy physical activity, self-monitor, keep appointments with healthcare providers, and call for help when needed. The Guided Care Chronic Care Management Solution will integrate the many aspects of care for your chronically ill population. The results will be better patient care and greater efficiencies in the primary care setting.